Right now, an extraordinary partnership is launching to bring testing and counseling to 2 million people in Western Kenya. Right now, Health at Home Kenya is linking the wisdom of business, governments, and the empath model. Right now, the people of Kenya are creating sustainability, building a future for those in need.
Right now, I'll be dead because I've been with empath for now almost 5 years. So you can imagine if I didn't know my status and maybe I could still continue with my behavior. So I think I'd be dead by now.
GBC is proud to be leading this exciting and innovative project, Health at Home Kenya. By combining the resources of several GBC member companies, the government of Kenya, Ampath, a very strong implementing partner, and PEPFAR, we're going to make a big difference.
This is the kind of investment, especially during these tough economic times, that I think every company, every donor should look at carefully. I think we'll get more bang for the buck, so to speak, with this kind of program than we will with almost any other program that's come across my desk in the last 10 years.
GBC's decision to call these impact initiatives is absolutely appropriate because I can't think of a partnership in Kenya anyway that has the promise of greater impact than this testing initiative in Western Kenya.
What we realized was that 80% of people who are HIV infected in Kenya do not know their HIV status. We also realized that 70% of Kenyans live in the rural areas. If we are going to be able to respond to HIV prevention effectively, we need to get people to know their HIV status, and that has to be in the rural areas.
We discovered as a government that although we have abilities and infrastructure to reach quite a few people in our population, there are areas that we cannot get to, and we needed a different skill sets that are inherent in businesses.
There are multiple areas that the business world knows far more than this old doctor is ever going to know, where they could come in and add a tremendous amount of value to this critically important area. The exit plan for all the money the world is bringing in here for HIV care is hidden in there.
We hope that this impact initiative will demonstrate to governments that the private sector is willing, the private sector is able, the private sector cannot do it on its own, but it's willing to play its part as it contributes to the socio-economic upliftment of the environments in which it operates.
This impact initiative is perfect for business because not only are we testing 2 million Kenyans for HIV, we're creating economic opportunity and hope for the future. This is a business-like approach for a sustainable solution, and we're going to make a big difference working together.
What we are doing is, after we do the testing, we are remaining back there to work with the community, and we see these as living ideas behind that can sustain people.
Wameweza kunisaidia sana kwa sababu nilikuwa mnyonge sana, sikuwa naweza chochote, lakini walinipea madawa, wakanipea chakula, alafu nikaweza kupata nguvu, alafu wakanileta hapa, wakanipa kazi. Ndio sasa naweza kufanya hiyo kazi, niweze kulipa nyumba, niweze kulisha watoto.
Companies from Europe, from America, from Africa themselves recognize that we are building Africa, that we have to unlock the real value in Africa. It's about allowing there to be real growth, sustainable growth.
I hope that part of what comes out of this partnership is growing interest in investing in Kenya, growing with Kenya. This is a country that has come a very long way, and I think with a healthier population has a future that is going to be breathtaking. I can't think of a partnership that has the promise of greater impact.
Right now, I'll be dead because I've been with empath for now almost 5 years.
Businesses that come on board now are building a long-lasting relationship with the Kenya government.
We see these as living ideas behind that can sustain people.
One of the best investments that the Abbott Fund has ever made as a donor is the Ampath program.